Welcome! Today, we'll walk you through how to read a lab report for a pap smear, especially if you're new to this. Pap smears are important screening tests that help detect changes in cervical cells, which can indicate infections, inflammation, or even early signs of cervical cancer. Understanding your lab report can feel overwhelming at first, but with a little guidance, you'll be able to interpret the main sections and know what to look for. Let's start by understanding what a pap smear is and why the lab report matters. A pap smear, also known as a pap test, is a simple procedure where cells from the cervix are gently collected and examined under a microscope. The main goal is to look for abnormal changes that could indicate precancerous or cancerous conditions. It's a routine part of women's healthcare and is usually recommended every few years, depending on your age and health history. The results are summarized in a lab report, which your healthcare provider uses to guide next steps. Reading your pap smear lab report empowers you to take an active role in your health. It helps you understand what's happening in your body and allows you to ask informed questions during your doctor's visit. While your healthcare provider will explain the results, knowing how to read the report yourself can reduce anxiety and help you make better decisions about your care. Let's break down the key sections you'll find in a typical report. The first part of your pap smear lab report usually contains your personal details. This includes your name, date of birth, medical record number, and the date the sample was collected. It's important to check this section to make sure the report is indeed yours. Mistakes are rare, but it's always good practice to verify your information before reading further. Next, you'll see a section called Specimen Adequacy. This tells you whether the sample collected was sufficient for analysis. It may say satisfactory for evaluation or unsatisfactory. If it's unsatisfactory, it means there weren't enough cells or the sample was obscured by blood or inflammation. In such cases, your doctor may recommend repeating the test to get accurate results. The next section is usually the general categorization. This gives a quick summary of the findings. You might see terms like negative for intraepithelial lesion or malignancy, which means no abnormal cells were found. If there are abnormalities, this section will indicate that further details are provided below. This summary helps you quickly understand if there's anything to be concerned about. If your report says negative for intraepithelial lesion or malignancy, that's good news. It means no precancerous or cancerous cells were found in your sample. This is the most common result and usually means you can continue with routine screening as recommended by your doctor. Remember, a negative result doesn't mean you're immune to future changes, so regular screening is still important. If your report mentions an abnormal result, don't panic. Abnormal results are common and don't always mean cancer. They simply indicate that some cells look different from normal. Your doctor will explain what the changes mean and whether you need further testing or follow-up. The report will specify the type of abnormality, which helps guide the next steps. Abnormal results are usually described using specific terms. Some common ones include ASCUS, atypical squamous cells of undetermined significance, LSIL, low-grade squamous intraepithelial lesion, and HSIL, high-grade squamous intraepithelial lesion. Each term reflects the degree of change seen in the cervical cells. Your doctor will use these terms to decide if you need more tests or just closer monitoring. ASCUS stands for atypical squamous cells of undetermined significance. This means some cells look slightly abnormal, but it's unclear if it's due to infection, inflammation, or something more serious. Often, your doctor may recommend repeating the pap smear in a few months or testing for HPV, the virus that can cause cervical changes. LSIL stands for low-grade squamous intraepithelial lesion. This means there are mild changes in the cervical cells, often caused by HPV infection. LSIL usually doesn't mean cancer, but your doctor may suggest further testing or close follow-up to make sure the changes don't progress. HSIL stands for high-grade squamous intraepithelial lesion. This means there are more significant changes in the cervical cells, which have a higher chance of progressing to cancer if left untreated. Your doctor will likely recommend additional tests, such as a colposcopy, to examine the cervix more closely and possibly take a biopsy. Besides the main categories, your pap smear report may mention other findings, such as infections like yeast or bacterial vaginosis, inflammation, or atrophic changes, common after menopause. These findings are usually not related to cancer but may require treatment or follow-up. Your doctor will explain if any of these are present and what they mean for your health. Many pap smear reports now include HPV testing. HPV, or human papillomavirus, is a common virus that can cause cervical cell changes. If your report includes HPV results, it will say whether high-risk HPV types were detected. A positive result may mean closer monitoring, while a negative result is reassuring. You might see a note about endocervical cells present. This is a good sign, as it means the sample included cells from the area most at risk for changes. If these cells are absent, your doctor may recommend repeating the test, especially if you're at higher risk. Sometimes, the report mentions reactive changes. These are usually harmless and can be caused by inflammation, infection, or recent procedures. They don't indicate cancer, but your doctor may check for underlying causes and treat them if necessary. Atrophic changes refer to thinning of the vaginal and cervical lining, often seen after menopause. These changes are not cancerous, but can cause symptoms like dryness or irritation. Your doctor may recommend treatments to relieve symptoms if needed. If your pap smear report mentions an infection, such as yeast, trichomonas, or bacterial vaginosis, it means these organisms were seen in your sample. These infections are treatable and not related to cancer. Your doctor will prescribe medication if needed. If your pap smear shows significant abnormalities, your doctor may recommend a colposcopy. This is a procedure where the cervix is examined more closely using a special microscope. Sometimes, a small tissue sample biopsy is taken for further analysis. Colposcopy helps determine if treatment is needed. A biopsy involves removing a small piece of tissue from the cervix for closer examination under a microscope. This is usually done if your pap smear or colposcopy shows concerning changes. The biopsy helps confirm if there are precancerous or cancerous cells and guides further treatment. Your pap smear report may include follow-up recommendations, such as repeating the test in a year, getting an HPV test, or scheduling a colposcopy. It's important to follow these instructions to ensure your health is monitored and any changes are addressed promptly. Pap smear reports use a lot of medical terms. If you see words you don't understand, don't hesitate to ask your healthcare provider for clarification. Common terms include squamous, glandular, atypical, and lesion. Knowing these terms helps you better understand your results. A typical pap smear report is organized into sections: patient information, specimen adequacy, general categorization, interpretation, and recommendations. Each section provides specific details about your sample and results. Familiarizing yourself with this layout makes reading future reports easier. Cervical cells are the main focus of pap smear testing. These cells line the cervix and can show changes due to infection, inflammation, or precancerous conditions. Monitoring these cells helps detect problems early, often before symptoms appear. HPV, or human papillomavirus, is a common virus that can cause changes in cervical cells. Some types of HPV are considered high risk because they can lead to cervical cancer. HPV testing is often done alongside pap smears to assess risk. Colposcopy is a follow-up procedure used when pap smear results are abnormal. It involves using a special microscope to closely examine the cervix for any suspicious areas. This helps doctors decide if a biopsy or treatment is needed. A biopsy is when a small sample of tissue is taken from the cervix for detailed examination. This is usually done if significant abnormalities are found on a pap smear or colposcopy. The results help guide further treatment. Squamous cells are flat cells that line the surface of the cervix. Most pap smear abnormalities involve these cells. Changes in squamous cells can range from mild ASCUS to severe HSIL, guiding the need for further testing. Glandular cells are another type of cell found in the cervix and uterus. Abnormalities in glandular cells are less common, but can also indicate precancerous changes. Your report may mention these if any changes are detected. A lesion refers to an area of abnormal tissue. In pap smear reports, lesions are classified as low-grade or high-grade based on how abnormal the cells look. This classification helps determine the urgency of follow-up. Inflammation is a common finding on pap smear reports. It means there are more white blood cells present, often due to infection or irritation. Inflammation itself is not cancer, but your doctor may look for underlying causes. Atrophy refers to the thinning of the cervical and vaginal lining, usually after menopause. It's a benign change but can cause symptoms like dryness or discomfort. Atrophic changes are noted in the report for context. A satisfactory sample means enough cells were collected for accurate analysis. This is important for reliable results. If the sample is unsatisfactory, the test may need to be repeated to ensure nothing is missed. An unsatisfactory sample means there weren't enough cells or the sample was obscured. This can happen due to blood, inflammation, or technical issues. Your doctor may recommend repeating the test for accurate results. Recommendations are the action steps suggested based on your pap smear results. They may include repeating the test, getting an HPV test, or having a colposcopy. Following these recommendations is key to maintaining your health. Routine screening means having pap smears at regular intervals, as recommended by your doctor. This helps catch any changes early, when they're easiest to treat. Routine screening is a cornerstone of women's health. Early detection means finding abnormal changes before they become serious. Pap smears are designed to catch problems early, allowing for simple treatments and better outcomes. This is why regular screening is so important. Prevention is the ultimate goal of pap smear screening. By detecting changes early, you can prevent cervical cancer and other serious conditions. Prevention includes regular screening, HPV vaccination, and following your doctor's advice. HPV vaccination protects against the most common high-risk types of HPV. Getting vaccinated reduces your risk of cervical cancer and abnormal pap smear results. It's recommended for preteens, but can benefit adults as well. Communication with your healthcare provider is key. If you have questions about your pap smear report, don't hesitate to ask. Clear communication ensures you understand your results and next steps. It's normal to feel anxious about medical test results. Understanding your pap smear report can help reduce worry. Remember, most results are normal or show minor changes that are easily managed with follow-up. Being informed about your pap smear results helps you make better decisions about your health. Knowledge empowers you to take action, follow recommendations, and maintain your well-being. Pap smears are a vital part of women's healthcare. Regular screening, understanding your results, and following up as needed all contribute to long-term health and peace of mind. Having a support system, friends, family, or support groups can help you navigate medical tests and results. Don't hesitate to reach out for support if you're feeling anxious or uncertain about your pap smear report. To sum up, reading a pap smear lab report doesn't have to be intimidating. Start by checking your personal details, then look at specimen adequacy and the general categorization. Understand the meaning of any abnormal findings and follow your doctor's recommendations. Remember, most results are normal or easily managed. Regular screening and open communication with your healthcare provider are the best ways to stay healthy.